I specialize in mistakes. I observe mistakes, I make mistakes, and I try to figure out how to fix mistakes. The mistakes that are made in the delivery system in the United States in healthcare have resulted in what Dr. Miller just described as a massive amount of healthcare inequity. And that's because the system has not adapted to the needs of the current population. And the system is relying on old ways of doing things and old ways of financing things. So a restructuring lawyer like me, we see mistakes having been made, putting healthcare systems in jeopardy. And what are those mistakes? Well, there are a couple interesting statistics that are important to think about. And I'm just going to talk for another minute or so, and I'll let the other panelists jump in here. But according to the latest National Institute of Health survey, which was in 2024, so it's a year old, about 25% of the healthcare systems in the United States are in financial distress, i.e. their potential clients. So why are they in financial distress? Well, it isn't hard, because what they do is they deliver medical care at a cost that exceeds what they get paid for. All right? Here's another statistic. Inflation. In the last 3 years, cumulatively, in the economy in the United States, inflation has been just over 14%. It's actually higher in healthcare. How much have reimbursement rates gone up during that same period? 5.1%. So this is a classic example of selling every product at a loss and trying to make up for it by volume. It doesn't work, you wind up in financial distress. And when you wind up in financial distress, you start doing things like, I got a great idea, let's sell all our real estate to a real estate investor and we'll just lease it back. We're not in the real estate business. A lot of hospitals have gotten into a massive amount of trouble by doing exactly that, because it doesn't really remove cost. You still have the same cost. All these leases are triple net leases. You're still paying the taxes and the insurance, the maintenance, everything else you were paying before when you owned the real estate, except now you have a landlord and you've got to pay rent every month, and you can't afford to do that. So you've brought some money in the short term, and you have created a long-term problem that is going to make your financial situation worse rather than better. Next solution, private equity. What a great idea. Let's get private equity involved. Now, let me be clear. Private equity is a wonderful thing. There's nothing wrong with private equity. In fact, private equity is part of the solution. It drives innovation. But when you take a money-losing system and you sell it to investors, it's still a money-losing system. How many privately owned, investor-owned hospitals are in trouble in the United States? According to the same survey I cited earlier, and this is the last thing I'm going to say, 35%. 35%, more than the general population. Because you can't just replace ownership and think that that's going to solve the problem. You have to attack it in a completely different way. How do you do that? You listen to people like Hal. I don't know Hal at all. I've never met Hal, but I was sitting back there watching his slides. And the answer is you change the model for the delivery. You use technology in smart ways to bring costs down so that you're actually delivering health care at a cost that you're getting paid for, so you don't wind up being one of my clients.